Up to 1 in 3 women suffer from a pelvic floor disorder, such as prolapse, but chances are you haven't heard of it. Hi, I'm Dr. Lindsay Kissane. Let's talk about pelvic organ prolapse. So pelvic organ prolapse is when any of the pelvic organs start to drop into the vaginal canal. The bladder or the uterus can sometimes drop down and give you symptoms of vaginal bulging. There are some non-modifiable risk factors, so things that you can't control, such as genetics, getting older, and going through menopause. But there are certain risk factors that you can control. Anything that increases the pressure inside the abdominal cavity tends to put pressure on the pelvic floor, and these can be risk factors for developing pelvic organ prolapse. So we tend to recommend avoiding anything that causes chronic straining, chronic constipation, chronic heavy lifting, chronic coughing, because those can increase the stress on the pelvic floor. Also, avoiding smoking is very important for your pelvic health and for the muscle health of your pelvic floor. Pregnancy and childbirth are things that can increase the stress on the pelvic floor, and they can tend to increase the risk of pelvic organ prolapse. So then one last thing that you can do to decrease the symptoms of prolapse are doing regular Kegel muscle exercises. If you're experiencing symptoms like vaginal bulging or discomfort, talk to your OBGYN or reach out to one of our pelvic health experts to see how we can get you back to feeling your best.